Hello and welcome to the Estee Show. Today, our guest is Masoud Assali, and we're going to be discussing the weird relationship that has formed in the US between employers and health insurance, other scary ways in which employment will be impacted by artificial intelligence. And it's a pretty bleak picture that he paints, but a very interesting conversation. And he doesn't shy away and he doesn't try to pad things. He just says them as he sees them, which I think you'll appreciate if you're in my audience. A bit about Masoud. Masoud Assali is the staff product manager at Intuit, working on platforms powered by artificial intelligence. Masoud likes to describe himself as a tinkerer who builds things from gadgets and home furniture to software. Prior to Intuit, Masoud worked with the Vertex AI team at Google Cloud and at a company called Darmian, which was backed by Y Combinator, one of the best accelerators in the world. And it was a medical AI startup working on precision brain health. A bit of a sneak peek into how I do episodes. Sometimes I reach out to a guest in response to a specific post or article that they wrote, and I know exactly what their position is, and I have a very good idea of how the conversation will go. When I saw Masoud's profile, I didn't see something specific that he wrote. Instead, I saw his background and thought the conversation would be interesting, but I had less of an idea of where the conversation will go. So it did take an interesting turn. I didn't expect it to become what it did, but I'm excited to share it with you and hope you'll enjoy it. We discussed a lot of different things on the pod, and I went back and pulled some numbers to make sure I wasn't making stuff up and saying things that were inaccurate. So I'm going to bring them here to you in the intro to help frame the conversation. How much does the United States spend on healthcare versus other developed countries? As a percentage of GDP, gross domestic product, much more. If you look at 2019, 2023, the US spent anywhere between 17% and 19% of its GDP on healthcare versus the next highest country in spending, which is Germany at 11.7% versus 8.7% for Italy. So that's 7 percentage points higher. In total dollar amounts in 2022, the United States spent $4.5 trillion on healthcare. If you look at it like per person, that's $13,494 per person a year. Over the last few decades, the cost of healthcare in the US has risen. As a percentage of GDP in 1980, it was 8.9%. In 1990, it was 12.1%. In 2000, 13.3%. And now we're in that 17% range. And with all of that, and the fact that the US outspends all of its peers, 8% of the US population, which is 26 million people, remains uninsured. Medical bankruptcy is an American concept. It's an unofficial term for filing for bankruptcy to eliminate medical debt. And according to Business Insider, it's the leading cause of bankruptcy in the United States. And it can lead to the loss of home, assets, and financial security. And if you're saying that the spend in the US is so high because people live longer, that's also not exactly true because the US has a lower life expectancy than the other high-income countries. It's more than 4 years below the 10-country average. Now, this is not to say that everything is bad. The US is a leader in science and technology with many new drugs and medical devices entering the market from the US. Quality, education, and research, as well as a range of healthcare services come from here. That being said, there is a lot to be desired and a lot to be fixed. That is what we were discussing in this conversation. Yes, we only touched the tip of the iceberg, but I think it's an important conversation to discuss and one I hope will continue. I hope you enjoy this conversation and find it as thought-provoking as I did. Please share it with a friend. Let's get started. Masoud, welcome to the Estee Show.
Glad to be here.
So you are currently in product at Intuit, formerly Google, formerly a YC startup that worked on detecting Alzheimer's. And we are here today to discuss the future of work. What are your points of passion? Where are you placing your bets that changes will take place and what will they look like in the next 5 years?
Awesome. Yeah. Happy to be here. I am generally passionate about building stuff. So the evolution in expedited prototyping is very exciting to me. I think it's a lot easier now than it was in any time that we can put together a prototype in hours.
So when you say evolution and prototyping, I assume you're talking about artificial intelligence and making it much faster to code. Is that what you're referring to, or you're referring to something else?
Yeah, I think coding is one of the major advancements with AI. Other tools that we are seeing also 3D printing, different prototyping tools that are emerging. I think kind of the market as a whole is evolving towards a direction that you can put together a prototype and test your hypotheses pretty quickly and figure out what's working and what's not working. Part of it is just asking your customers what they want. It's a lot easier now to do that than it has ever been.
So customer discovery, I'm just taking notes and we'll dive in. So you're talking about the future of work as it relates to work development, and you are focusing on the technology sector and really like research and development, the part of technology which is developing new things, putting bets on what customers want. So really this whole discussion is about increased productivity, that those tools allow for what would formerly take a team of 10 and 8 months now would be a team of 1, maybe a team of 2 to like help keep the person going forward, and 2-3 weeks of tweaking. What are examples in the market of companies that are actually going big and, reaching scale, that are following this, solopreneur mindset?
I mean, look at the big dog is OpenAI, right? They started as a tiny team. Now they're a multi-billion-dollar company. And it really started as an idea, right? There was a paper that was...
Is that Datadog? Which company did you mention?
OpenAI.
OpenAI, yeah. Got it.
Yeah,
but they had a ton of financing, or you're saying they could have a ton of financing. That's not a problem.
So actually, what I gathered is they had to really shop around and figure out who can support them with the training financing. Otherwise, they wouldn't have been able to put out the products that they are putting out now. But the similar dynamics extend to the startup ecosystem as a whole. Is there was a time that you had to have a full-time employee to write content for you. Let's say if you're developing e-commerce website, right? You had to have copywriters, you had to have graphic designers, you had to have a whole bunch of staff to regularly update your website. Now you can automate a whole bunch of those. Now there was a kind of a step between. There was this era of outsourcing and
gig economy.
That kind of started to take hold. But then a lot of people were realizing that, first of all, it's very difficult to convey your vision to someone who is significantly different background than you are. So, for example, if you're, let's say, hiring someone from Southeast Asia, trying to explain what you want in your graphics or in your, let's say, logo, it takes more time than if you had done it yourself. Right. So a lot of these things the efficiency is showing in the outcome.
So, okay. So this gets to what I'm interested which is as a result of this whole situation, who gets screwed? It's the employee. It's like, we needed you. We used to pay you a full-time salary. Oh, we don't even have to pay you a full-time salary. We could pay you a part-time salary. Oh, we don't even need you at all. Go, to greener pastures. So we all know that AI is leading to job elimination. And, you and I were talking about the future of work, and you took, I think, for the first portion of this conversation, the perspective of the companies, the advantages and the cost-saving opportunities, which are definitely there. What does that mean for employees, that there is, because it does seem like for employees, the pie is getting smaller.
It is a very tumultuous time for labor, I would say. The labor market, I think, is ripe for major disruptions and not in the favor of the worker. I think it's just a very unpredictable time. So some of the elements that lead into this, we have to kind of look at where the value comes from, right? So if you look at, let's say, the Industrial Revolution, the value was in physical ability, right? So whoever was stronger, whoever had more, bulls or horses, they were ahead.
Horsepower.
Yeah, exactly. So that kind of transitioned into steam and locomotives, and whoever had large amount of stock weren't really the top dogs anymore. The one with the locomotive had the power, right? That kind of, if you follow that line, the value generation has changed from that person or that horse to that locomotive. The same thing happened with the internet, right? There used to be people who would publish newspapers had a lot of power. Eventually that kind of moved to Facebook and social media and things like that. So the value moved away from the traditional concentration. Now I think that's happening to the labor market again. And it's kind of a scary bit in my opinion, because usually you would think that the market plays itself out, right? If you're operating in a free market, especially in America, labor mobility is very, very vibrant, right? So people can pick up and go to a different state for better opportunities, for example, right? That's not the solution anymore. It doesn't matter what state you live in, or it doesn't matter what locality you live in. It doesn't really matter if you're in a different country, because they're kind of lowering the barrier to entry in general. So everybody is in this market. Like anybody can be their own content producers. We saw this with TikTok, right? So the question remains. I don't know what will happen to the layman, but I have a feeling that they're going to get screwed first.
Okay, so on the topic of laymen getting screwed is another thing I was thinking about when we were planning this conversation. And I think it's timely with the murder of Brian Thompson, the United Healthcare CEO. I just want to say, murder is horrible, and there's no justification for that. But a lot of people are talking about insurance, and it's so horrible and screws over the people. In my opinion, and I'm a product manager, so I think I'm speaking from a product perspective, but I think the way it's set up in the United States, all of the incentives are misaligned. Because insurance goes through the employer, and the history on that is that during World War II, it was illegal for companies to give financial raises. So instead, the government gave companies tax breaks. They said you won't have to pay taxes if you provide the medical insurance to employees. And as a result, companies started competing for employees, not with money, but with the benefits. So that's a little bit of the history on how in America, insurance got tied to the employer. Why are the incentives messed up? Is because what are the biggest needs for insurance? So obviously, terminal illness, cancer, all of those are really expensive. Statistically, those happen later on in life, usually after someone retires. The biggest thing is paternity, maternity leave. The government should be incentivized to have employed people, procreate, because that's going to raise the next generation of taxpayers, soldiers, whatever. And it's the government that's the interest of the government. The interest of the employer is to minimize costs, but to retain talent. The interest of the insurance company is to retain the client. The customer, the patient isn't their customer. So the employer is the last party that's incentivized for their employees to have children because it's number one, it's going to cost a fortune. Number two, you're going to have an employee with a break that you're going to have to figure out how to fill. You're not interested that 20 years down the line, you're going to have employees to hire. So as a result, I think if companies could, they would offer zero paternity leave, zero maternity leave, especially in a country which doesn't mandate it. And the only reason they offer generous policies is because they want to compete for talent. So as a result, when it's an employees market, like we saw in 2020, 2021,
companies are very generous. They have 12 weeks, 16 weeks, 20 weeks, you name it. And then the second the markets turn, that's the first thing that starts getting cut. And it's like the employees are on this roller coaster and dependency that's just not entirely up to them. I would say almost entirely out of their control. So curious, like this hasn't really been a conversation, like the way health has become a conversation in the last year. But I think it's a huge issue. We spend a ton of money on it as Americans. Everyone needs health insurance. Everyone has medical care. So where do you think that plays into the future of work? And especially if the future is bleak as you're describing it, and a lot of people will be out of a job, at least until we see what the future looks like.
Yeah, this has been perhaps the biggest culture shock for me when I came to America.
Tell me a bit about the background. Like, where do you come from? What was it like there?
Yeah, so I was living in Austria, and they have a tremendous healthcare system for the admittedly small population that they have. So Austria is an 8 million person country, and they are
Freudian slip over there.
Exactly. They have universal healthcare in the country, and it costs a fixed amount per year. I think it's like 300 or 400 euros a year, and everything is covered. And the good thing with that is it's very easy to find care. So it's the issue of access to care, because you hear in different systems, for example, the NHS in Britain or in Canada, people complain about wait times or different levels of care that they receive. I think the Austrians and the Germans as well, they have managed to come up with an interesting process of kind of hybrid private-public insurance. But yeah, so to me, this was a shock when I came here for grad school, and it was basically, good luck. You're on your own. Figure it out. Right. So that was the feedback.
Welcome to America.
And I acknowledge that I had the privilege of being a full-time employer and employee and having the benefits of having healthcare. I remember when Obama was pushing out Obamacare, the stats that they were throwing around was like 1 out of 6 Americans doesn't have healthcare. So that kind of statistics is embarrassing, quite frankly. It's like for a nation of this magnitude, it's very difficult to fathom that a majority of people don't care that 40, 50 million of other US citizens lack care. So that to me, it was like, I get it. America has a kind of an individualistic approach to society and how things should be run. I hold my own. You go figure out your side. But some things we have to come together. And I think healthcare is one of those. And if you want to look at it from a business point of view, it also ends up in the same area, right? So if you think about it, I'm a big proponent of free markets. I think people should compete. Businesses should compete. They should have the ability to attract good talent. They should have the freedom to move resources around and figure things out for their stakeholders. The problem with privatized healthcare is you're practically putting a price on human life. You're basically saying, if you get cancer, good luck, right? So because your treatment is going to cost a lot, and if you can't afford it, then you're on your own. We're neglecting a portion of the society because of access, basically.
So I'm also a proponent of free markets, but I have to say, like, there are cracks in my belief. Like, I need to figure some stuff out. But let's say an alternative, because what's happening now, where it's going through the employer, that's also not a free market. Like, what if the government either offered the same tax break to the individual, or just why should anyone have a tax break? Like, it should be you should be able to get it on the free market.
Yep.
Then the laws of the free market should come into place, demand, supply, the prices should come down and the service should improve. This is theory, exactly. But like, shouldn't that also work?
Absolutely. So first, let me put out a disclaimer that I'm not an insurance expert. So this is purely my personal perspective. But I think when we got the kind of high level premise of let the markets decide how healthcare should be managed, it kind of went down the hill from there. It kind of screwed the whole process off, because now you have these middlemen as insurance trying to penny and dime every bit they can, right? And that's where the cracks start to show, right? Now, for me, I think one of the more reasonable approaches might have been, for example, what we have for the VA, right? Veterans Affairs, they get very good service and they have good access to medications and all that stuff. And admittedly, it costs a lot of money, right? But they're worth it, right? If somebody fights for this country, they better get the care that they need, right? Similar for, let's say, for Medicare, right? We have figured out a way to provide health benefits to our senior citizens. I think that's a functioning model.
But that's bankrupting the country.
So,
like, if you look at healthcare costs, they're just rising and rising, and it's the biggest portion of the GDP that it's ever been.
That's true. And that's inevitable. I think any advanced country you look at, the majority of the GDP will be spent on improving life, and a big part of that is healthcare, right? So I just want to be clear that we're not an exception in this. Every other country is also trying to figure out how to provide good healthcare to their people. But so on the positive side of it, let's look at the positive side as well, right? I think first of all, U.S. institutions produce the most advanced research that you see anywhere in the world. That's phenomenal. Like any person who's worth their dime, they come to the U.S. for research, and that's a huge advantage for whoever is dealing with the medical industry in America, right? So that's a major benefit. But at the same time, I think the ability to manipulate markets also is the kind of the downside to that. You see a lot of these pharma companies actually figuring out how to play the stock market just so that they have either they protect their patents, or they have all these little
right.
bits and pieces that the same drug that you're getting in the US is maybe 6-7 times the price.
More expensive.
Yeah. So these are tricks. Like, you can't convince me that the exact same drug that I bought in Austria costs 1/10 of the price here in the US. That's market.
Right. What the economists say is that you as an American are subsidizing the Austrian or the Canadian. I don't know if that's true. Is that true?
I think we are. So the way I see it is, we spent a lot of money coming up with very good drugs, and the buyer of these drugs, the governments who actually kind of like what we have here as the FDA, each country has their own Food and Drug Administration. When they approve a drug, they put a price limit on it. So you can't really sell in the Canadian market unless you abide by those guidelines. And that's fine. These drug companies are...
So what would happen if the US FDA started acting like the Canadian FDA?
I think the share prices will drop. I don't think you will see less research. I don't think you will see fewer drugs on the pipeline. I think the price of the stock market will get hurt.
So, okay. So in one word, you are elected, I'm not going to say president because you're not American, but advisor to the president. What's the strategy? What if you have all the votes you need to pass any of the changes you want? What do you change?
I would err towards kind of a national, either VA or national Medicare, expanding Medicare to everybody.
Okay. And then taking that back to the employer market and to what will look like 5 years from now, in the context of healthcare, let's say the conversation does move in that direction. I don't know if it will. I think the country is very split on that. But honestly, I think you'll find people on both sides of the aisle who want good healthcare. So how is that going to change the dynamic around the employers and companies in the US, given everything we've discussed?
So I think companies will still have the advantage of providing more perks to attract better talent. I think the fact that everybody is complaining about the current healthcare situation gives big employers good excuses to kind of shift towards a better solution, right? I remember it was I think Goldman Sachs that partnered with Berkshire Hathaway and Amazon to put out with basically come up with their own insurance program, because they figured the market is so broken, and among the three of us, we have 1 million employees. We may as well just do our own thing, right? So I don't think that even the big companies, not the smaller players, even the big companies are suffering from the difficulties of choosing the right healthcare for their people. I remember at some point at Google, there was this conversation that they wanted to change suppliers, healthcare suppliers, and people were completely upset because every time you make a change, you're basically screwing one part and then you're trying to benefit the other part, right? So,
right.
Now, I think all things considered, and I usually say this fairly early on in my conversations, is I never bet against America. I think America figures it out. But this particular industry has become so complex that even major players like Berkshire Hathaway haven't been able to. And they have, Geico is one of the biggest insurance companies in the country. They have the know-how, but even they are struggling. So one thing that I'm optimistic about is some of the advancements in the medical industry, especially with hardware. I think it's improving some of that problem. And one of them is, for example, you see these clinics popping up that are almost completely self-serving. It's like you just walk in and they'll take care of, and you might not even interact with a person. It might be entirely automated. So to understand really why everything is so complex, I think you should also consider why the prices are so high. For example, cancer treatment is a lot more expensive here than it is in other countries.
Yeah. I mean, we're running up on time, but I would love to continue this conversation. Like, there's no reason. I was in Israel a couple of weeks ago and someone asked me, we're in conversation, how much does it cost to give birth? And I said around $40,000. And I was like, how much does it cost here? And they were like, $0. We don't pay. Like, total shock. Yeah. But I mean, I think it's definitely a thought-provoking conversation. I like how this is like, America is great. What's the one message you want to leave our audience with?
I think we as a country should have a very thoughtful conversation about how the future of the job market will impact our lives. Because the way I see it, AI is going to disrupt 70-80% of what we do. And if that is not a red flag, I don't know what is, right? Because at the end of the day, to me, it's you have to go and look at where the value is generated. Right now, we're a services country. We basically produce a lot of value through different services, including, having financial services, legal services. A lot of these things are automatable. Like they're easily automated. And if you think about 80% of the country is being impacted by these automations, then where's the tax revenue coming from? Right. So there's a lot of concern for me if suddenly the job market takes a massive hit. So yeah, I think we have to have that conversation.
Okay, so take this as an invitation to come back to have this conversation. We'll talk about the rising costs, just the high costs in general of healthcare. We could also talk about the cost of education, and we'll talk about the future of the job market. I will say, I feel like everyone I've had before who's talking about the future of job market is like, yeah, jobs are going to be lost, but then you'll need jobs to manage AI. It's like, yeah, but if you look at the percentages, most of the jobs are going to be eliminated.
Yeah.
So let's do it again. Masoud, thank you so much.
It was a pleasure.
If you've gotten this far, thank you for listening to another one of my episodes. Remember to follow the Estee Show on whichever platform you use to listen to podcasts. If you have any feedback, questions, or just want to share your own experiences, don't be shy. Hit me up on LinkedIn or email. That's estee.podcast@gmail.com. I'm all ears. Until next time, stay curious, stay bold, and never stop learning.